Welcome to Alpha Coding Podcast, an all-access pass to medical coding and billing pro tips that help you start your week off smarter. And now, here is your host, Toni Elhoms.
Hello, everyone, and welcome to the Alpha Coding Podcast series. I'm your host, Toni Elhoms. Welcome to episode 62 of the podcast. Today is March 8th, and I don't know if it's just me, but it feels like this year is literally flying by. It's already almost the middle of March, and it feels like 2021 just started. So I'm excited for today's episode because I invited another guest to join us this week, and we're going to be talking all about streamlining your revenue cycle management processes. So before we dive into our topic, it's time for your Monday dose of positivity, the Mindset Monday tip. And it's brought to you by Project Resume. When is the last time you had your resume updated? Your resume is literally your entry ticket to that next great opportunity. Project Resume will design a customized ATS-friendly resume to demonstrate your unique skills and experience. And even better, it's written by coders for coders. Make that investment in yourself today and visit projectresume.net and mention my code ALPHACODING for special pricing. So our Mindset Monday tip is all about letting go of your own time clock for life. The quote I want to share with you says, "Trust the timing of your life." And I think this is a super important reminder because we all have this idea of when things should happen in our life, when we should achieve certain life milestones, when we should achieve certain levels of success. And your ideal timeline for when those things are going to happen is not always going to be the case. And so you want to trust in the timing of your life, because if you're constantly in a rush, you may not be ready for that level of success. You may not be the person that is required to have that level of achievement. And there's some things that you have to do internally and work on in yourself to get to a point within yourself where you're ready to accept those things and accept those levels of success. Every single person that comes into your life, every single failure, every conversation, every job you have, every life experience, every single moment, macro and micro, is meant for you, the good and the bad. So really embrace that and trust the timing of your life. Our guest for today is Rozmin Bapat, and she's in the Dallas-Fort Worth, Texas area. Rozmin is the president of CodeRite Healthcare Consulting, which is a medical billing and healthcare consulting company. Rozmin is known as a revenue cycle management champion, and she also has a YouTube channel, the CodeRite Healthcare Consulting YouTube channel. Definitely go check that out. And I invited Rozmin on the show today to discuss her best pro tips for streamlining revenue cycle management. So thank you for joining us today, Rozmin.
Thank you so much for having me, Toni.
Absolutely. So let's break this down for our audience. Let's talk about RCM, revenue cycle management, deconstruct this, and how it can literally make or break an organization.
Okay, so the revenue cycle does not begin at claim filing. Revenue cycle actually begins when the patient calls the office to make an appointment. For the front desk to get the accurate information from the patient, their demographics, their insurance, all of that is the first part of getting the revenue cycle started. And then the next step comes in when the insurance verification happens, finding out things like patient's eligibility, their co-insurance, out-of-pocket responsibility, deductible accumulations, and also, most importantly, finding out if a referral is needed or a prior authorization is required. So all of those steps actually are foundations of a revenue cycle. And then comes the coding part, and accurate coding of services and procedures is so crucial to getting that claim paid the first time. Coders are trained to put the right E&M code into the claim, what diagnosis will go in there. Also, you have to look up the NCD, run the codes through the NCCI edits to make sure that you're not unbundling services. So those are all very, very important steps to an effective and efficient revenue cycle. And if you not complete even one of these tasks, that can completely unravel the process. And then you'll have the claim denials and rejections, and the rework will add more cost and strain on the practice.
That's a really great deconstruction of the RCM process. And You said it best. I mean, the micro and the macro level details that you have to constantly monitor, it's just unbelievable. So that was excellent. In your specific experience, what are some of the most common gaps that you see in maybe your clients or folks that you consult with in their RCM processes, and how do you think they could benefit from streamlining?
So the number one gap that I see in medical practice is lack of staff training. I think that, I've worked with multiple medical practices, and I know that, medical practices, offices can get so busy and the day-to-day work can get so overwhelming. And the front desk is the only position that I know is very underrated, and it's very undertrained as well. Somebody goes out, or if somebody is taking a sick leave or anything like that, or somebody quits, you just want to put a warm body there, and just have them kind of start, without proper training. And I think that's such a disservice to the practice and to the patients as well, because the front desk is the voice and the face of your practice. They are the people who are answering the phone. They are the people who are triaging the patient. They are the people who are greeting the patient into the office when they come through the door. So, I see so many front desk people who are just kind of put in that position without proper training. A lot of them don't even know the difference between a Medicare Advantage plan and traditional Medicare. They don't even know what's a PPO, what's an HMO, if an insurance requires referral or prior authorization. All of these things are kind of, not even looked at, offices don't put proper, resources behind training these front desk people, because this one position also has a lot of turnover. It's a very high turnover as well. So maybe the resources are not put behind that, but I think it's so important to train your staff in proper billing practices.
I couldn't agree more, Rozmin. And, one of the things I tell entry-level people that are kind of just breaking into the field is, if you can get a job at the front desk, you have no idea how much exposure you're going to have to coding. Almost everything you're going to get to see is going to be so foundational in your success in RCM. So I really like how you highlighted that position. So in your experience in your consulting practice, what are the most common billing leakage areas that you encounter?
Incorrect insurance information added into the system. Not adding, with the new Medicare numbers, they're all alphanumeric. It's, one number and then two letters and another two numbers and letters. I mean, you have no idea how many people mistype those numbers and digits. So insurance entered incorrectly, and also not updating insurance. So let's say a patient is coming into the practice, every 3 months, and they had Blue Cross in January, but now it's April, and then they have United Healthcare, but because they got a new job or something like that, but they failed to tell the practice that. And the front desk hasn't even asked the patient. They're just assuming that the first time the patient's coming in, they were just here in January, so I'm sure nothing's changed. And when they ask the patient, has anything changed? The patient's like, nope, everything's same, because at that time they're not thinking about it. So asking very specific questions and actually taking their card. And it's like, I need to scan your card again. I mean, scan the patient's card, 12 times a year if you need to, but make sure that it's accurate. It's in your system with the correct date. So I think insurance information and the absence of referral and prior authorizations as also, I think, leads to the leakages also, because I've also seen, and I'll give you another example here, is a doctor sees the patient in the hospital, and then the patient comes into the office for a follow-up. Patient has an HMO plan. A hospital sends a referral, which is just with a number on it. That's just the hospital's record-keeping number. That's not really a referral from the patient's PCP. It's the specialist staff's job to get that referral or numeric referral from the PCP office, and they have to run it through the patient's insurance. So a lot of times, like I said before, lack of training leads to these kinds of leakages in the revenue cycle.
It's so true. And then Medicare had to change their IDs, right? We knew that was going to be a recipe for disaster.
Yeah, and it's like, the zeros and O's and all of that. Yeah, you can completely get lost in that.
One of the most common things I hear, and I'm sure you hear it all the time, Rozmin, is, well, I got paid for it, so that means I did it right. Can you share your thoughts on this comment and your experience with post-payment recoupments?
Yes, I actually get that a lot from the physicians. They push back on the coding part. A lot of times when we work with doctors, they want to put their own codes in there, which is doctors want to see their patients. They want to take care of their patients. I respect them tremendously, but I also think that the coding should be left to the coders. So yeah, the claim got paid, but when the claim actually goes electronically to the insurance company, the documentation is not accompanying it. And you and I both know that post-payment audits are happening now, and they're happening more frequently. So if they do see that there was a discrepancy in the code that was submitted on the claim and what the documentation says, yeah, they will come back and say, hey, you owe us this money back because you didn't code it correctly. So, we do a lot of documentation training for providers, and we tell them, documentation integrity is so important. Coding needs to be based on the actual service provided and not based on the level that pays more. And as coders, we know the golden rule that, if it's not documented, it's not done.
Yep, that's the golden rule we all live by. And it's such a point of contention, but let coders be coders. That's what we're here for. You as a provider, as a physician are just not going to have the same tools in your toolkit that we have because that's our expertise. So I like that. So let's talk about outsourcing RCM to other countries. This is something that has been trending. We've seen this common in waves. And what has been your experience with this, and how do you advise organizations that may be thinking about outsourcing because of the cost reduction?
So if anybody follows me on LinkedIn or any social media platform, they know that I'm very vocal about this. I absolutely do not recommend outsourcing RCM to offshore companies. And I'll give you, of course, a couple of examples here as well. We've had providers reach out to us who had these companies that were doing their billing. And Toni, we have spent countless hours cleaning up their AR because of so many gaps and so many things that they leave on the table, and the physician doesn't even know it. Offshore companies have automated their processes so much to cut costs that no human being is actually looking at a claim. If it's denied, it's made patient responsibility without even any kind of follow-up. Did you see a PR 96, non-covered, but that doesn't mean that you make it automatically patient responsibility. There's so many reasons that claim is denied, but since it's just going through an automated system, it's just spit out and then made patient responsibility, and the patient gets a statement and it's like, what is this? Another thing that I've learned with these companies is that they don't work a lot of denials, first of all, and then they want the providers to actually have a biller in their office to enter the codes, to enter the modifiers, to check all these kinds of things. You actually need to have another person in your office to be doing all of these things. And I know that sometimes, if a doctor is just starting out, they feel like, oh, okay, I can do this. I can put my own codes in there, but the doctor will get busier. Their practice will grow, and then they won't have that kind of time to do these things. So, and then it's these companies are doing 80% of the billing and not really giving you 100%, and they'll entice you with low percentages and all of that, but then it's you get what you pay for. So and of course the most important part I want to share here is that offshore companies are not subject to HIPAA laws, so there's a better chance of non-compliance, and in case of any data breaches, they will probably not be held responsible because they're not in the country, they're not in US. So basically, you end up paying more when you hire an offshore billing company in the long run.
Yes, Rozmin, I've seen your post on LinkedIn, and it's one of the reasons why I wanted to bring you on the show, because I think it's really important that we as industry experts, get really loud about this. You get what you pay for, and we have been there and witnessed and cleaned up these messes that are completely avoidable. So this show is all about pro tips. I want to hear your top 3 pro tips for streamlining an organization's revenue cycle management.
So number one is training and cross-training. Cross-train your staff to know at least the basic insurance information and the accurate verification of benefits. So insurance verification process, knowing the difference between a Medicare Advantage plan, traditional Medicare, knowing the difference between, Medicaid, HMO plans, also knowing the difference between PPO, referrals, authorizations, outpatient, out-of-pocket, deductibles, all of those things. So training. I can't emphasize that enough. Number 2 would be if a practice does decide to outsource their billing to a billing company, they must do their due diligence in vetting that company. They need to ask questions about the denial management process. They need to ask questions about reporting. They need to ask questions about patient billing. Who's going to answer questions from my patients if the patient is calling? Am I going to have somebody in my office do it, or is your billing company going to take care of that? Are the patients going to be able to reach out directly to you? Those things are important. And of course, don't get swayed by low percentages. That's what I would say, that, it would seem upfront that, oh my God, somebody's doing your billing for 2%, but you're going to add on so many things on top of that, it's going to come out to be extremely expensive in the long run. And number 3 would be invest in systems that automate some of the processes, such as eligibility verification, prior authorizations, appointment confirmations, and also make it easy for patients to pay their bills online by offering online payment options. So make it as easy for your patients, but then also take a lot of things off of your staff, a lot of these clerical things that are just, busy work per se. So if you take all that off their plate, they have more time to contribute to their effective revenue cycle, because a lot of times the offices do get so busy with this busy work, with calling the patients for confirmations and stuff like that. That can all be automated.
Those are excellent pro tips. So I want to hear more about your work at CodeRight and how you made the leap from employee to business owner.
Okay, so my experience in working with medical practices began 15 years ago with a front desk position. So I've worked as a biller, I've worked as a coder, I've done internal documentation auditing, and then finally became a practice manager for a cardiology office, handling all aspects of running a medical practice. So I've been everywhere in a medical practice. I haven't done any clinical work because I'm not trained for that, so I leave that to the experts. And then, of course, along the way, I acquired 2 coding certifications, one from AHIMA and one from AAPC, respectively. Then went on to get my CPMA, and then last year I got my CPCO, the Compliance Officer certification. I started CodeRight in 2015. First of all, it was because I had just had my daughter the year before, and I wanted to just not have some flexibility. So selfish reason, of course, but then another reason was that I saw such a huge gap. I saw a huge gap where I felt like I could help the doctors, and because I had the inside view, I could help the doctors in all aspects of running their practice efficiently. So we are CodeRight is primarily a medical billing company, but we also provide coding services, practice management consulting, and HIPAA compliance. So, and what sets us apart is that we don't have any cookie cutter solutions. So we're not going to have like a whole folder for you, and it's like, okay, we do this. It's pretty much like, okay, going into the doctor's office and asking them, what do you need? What is it that you need? What are your pain points? And trying to understand what they need and then design a customized solutions for their needs.
That's very inspiring, Rozmin. I know I told you this before we went on the air, but there's so few of us, 1% of coding and RCM entrepreneurs. So it's really cool to hear your story. So what's next for you, Rozmin? You've got a YouTube channel, you've got a successful business.
Well, I'm just getting started. So, fortunately, we are growing. We're growing with a solid base of clients who trust us to handle their revenue cycle. We're very fortunate that way. And then this year, my goal is to invest heavily into the compliance part. Since I did get certified as a compliance officer last year, I've gotten a lot of insight into the gaps in medical office compliance, especially small offices, single doctor, two doctor offices where, they may never have had a compliance plan, or they just kind of bought a binder from a company that's a standard binder, and it just is collecting dust on some shelf in the office manager's room. So those are some of the things that I'm trying to produce a lot of content around that, how important that is, because you want to make sure that the doctors know that it's a lot cheaper for you to have a prevention plan in place with all of these things than to, get audited and pay those very hefty fines. So those are some of the things that I'm working on right now. And then we provide part of the compliance plan that we have is we provide employee handbook. And like I said, it's all customized. So it's not going to be like we're just going to take an employee handbook from a corporation and we'll be like, here you go, that's for you. It's not like that. We sit with the office managers, we sit with the providers, and we see what their needs are, how many employees they have, and all of that. And we bring that all together. We do policy and procedure manuals, and we also do part of coding and documentation audits. And a big part of this is, and then after doing all of these things, also provide a lot of training and education to the providers and the staff. So everything is fully customized. And I do believe that providers, doctors, they need to concentrate, or they need to focus on what they do best, and that is taking care of their patients, and leave all the other stuff to people like us, coders and consultants who can make them run their offices and their practices very efficiently and help them grow.
Well, that's very exciting, Rozmin. I'm excited to see all the amazing things that you're going to do. So thank you so much for joining me today.
Thank you so much for having me, Toni.
So be sure to connect with Rozmin on LinkedIn and check out her YouTube channel, CodeRite Healthcare Consulting. So it's time for this week's coding pro tip, and it's brought to you by Contempo Coding, which is an on-demand educational resource provider created for coders by coders. They specialize in affordable coding certification prep courses to help you accelerate in your career. Right now, they're offering an exclusive special to Alpha Coding podcast listeners, and that's $125 off the Certified Risk Adjustment Coding Prep course when you order through our affiliate website. This prep course has a 100% pass rate, by the way. Visit our website, alphacodingexperts.com, and head over to the Deals and Discounts tab for a link to take advantage of this absolute steal of a deal. If you have a coding-related question and would like it to be featured in one of our coding pro tips, please reach out to me on LinkedIn, Facebook, Instagram, or YouTube. And I just want to say to all the folks that have submitted questions, I really appreciate your submissions. What I do with those is I take them, I put them on a list, and I pick from this list every week as I'm laying out the show. So thank you guys so much. So this week's coding pro tip comes to us from Florida. Hi, Toni. I've been listening to your podcast, and wow, what great work you're doing. I'm a trauma registrar looking into becoming a CRIP or a CCS. I have no associate's or bachelor's degree at this moment, but I'm considering getting a bachelor's through the Western Governors Program for HIM. Do you think this is the right step for someone like me who is looking to break into the field? Well, first of all, I want to say thank you for your support and for listening to the podcast. I'm sure I'm going to catch some flack for this answer, but I do recommend you take some really important courses like anatomy, medical terminology, pharmacology, a lot of the basics that are needed for medical coding. Those courses are critical. But to answer your question, I don't think a bachelor's degree is necessary for this field. And the reason why I say this is because I know a lot of people with the RHIA credential, the RHIT credential, people that have all of these HIM degrees, but are stuck in their particular situation. They're limited in their advancement opportunities. And I've seen this time and time again. And this field specifically, hands-on experience is going to trump all of the education. Yes, education is important. And that's why I say invest in those courses that are going to be really critical to you if you want to be a coder. But I don't think a 4-year degree is required. I actually discourage a lot of people from taking this track and really encourage the hands-on experience. So with your experience as a trauma registrar, you already have healthcare related experience. So I would recommend getting your foot in the door if you can get an entry-level position in medical records or health information management, or if you want to work on the Profi side, any type of hands-on experience is going to be much more valuable to you than the 4-year degree track. So I hope that points you in the right direction. Please remember to hit that subscribe button now so you never miss another episode. Also, be sure to drop us a 5-star rating and review on iTunes. We really appreciate your support. So this concludes today's episode. Until next week, thank you for listening to the Alpha Coding Podcast. We'll see you next Monday.
For more information about medical coding and billing pro tips, including how to hire alpha coding experts, follow us on LinkedIn, Instagram, Facebook, YouTube, or visit our website at www.alphacodingexperts.com.